So how do you start to speak to somebody about the potential that, yes, there is this physical condition, or disease or some kind of ailment, but alongside that will almost positively be some kind of psychological impact. And I think to myself, it's almost easier to, well, not easier, but there's almost something simpler about saying, this is your condition, you have this part broken, or you might need this surgery. And whilst that's really confronting, and perhaps we can talk about that in a moment, how what that brings up, because that's a crisis for most people. If I have someone come to me and I need to broach the subject about their psychological concern, it's almost as though that's more difficult for them to hear.
I agree entirely. And I think in my practice over the years, as I've learnt more and been involved in some research with regards to psychological aspects of particularly epilepsy, I've tried to normalise it as a part of my practice. So it's now something that I will raise, with every patient, particularly say a new diagnosis. I'll say, right, you've got focal epilepsy. I explain what that means. And then I say the management of this condition is using medication, looking at lifestyle adjustments, because things like sleep deprivation, stress, and excess alcohol can trigger seizures. And the third aspect of your care is managing and maintaining your psychological wellbeing. And I explain that. And I think most medical conditions would be the same. Certainly there's good data, and it's been, spread for years that, saying the things I look after commonly, epilepsy, seizures can be triggered by stress. There's now, animal-based research that shows stressed rats will have seizures more often than non-stressed rats in the lab, exposed to the same sort of trigger that, stress can trigger these conditions. And I say we treat the seizures with your anti-epileptic medication. If we don't treat the anxiety or the depression or the adjustment disorder that's evolved because of those seizures, that's going to increase your stress level and make you have more seizures. So unless we're trying to break this cycle on both sides by treating your seizures and the seizure disorder and managing the psychological aspects of this whole process, we're not going to win. And so I think just by slowly normalising it, and many people will just go, okay, whatever. And it takes you many more times to actually, I guess encouraging that, acknowledging that that's a part of the illness. And the other important thing I often say is those feelings of being anxious or sad or depressed about having this condition, they're not coming from outside of your head. They're coming from inside your brain. These feelings are evolving because of neurons communicating inside your brain in the same location that those neurons are going a bit, wacky every now and then and causing a seizure. So we need to regard it as an organic aspect. And for some people, that makes it more acceptable, which I think for all of us, it's like, oh, yeah, that's true, actually. It's not me being a bit, acopic. It's actually my brain's reaction to this, and it's neurochemical. And I can change that chemistry by actually engaging in psychological strategies that you'd be teaching people.
So what I'm hearing in that is the importance of us looking more broadly at what it means to be well.
Exactly.
And if we look at wellness more holistically, we need to understand that when something happens in life, so a crisis, whether it's an illness, whether it's, what we've just been through, where people's whole worlds have been turned upside down this year, that what we, in order to be able to manage, we need to look more broadly at what that means.